Welcome to our Insight series on organizational well-being. Our question for this week is, what does a typical traditional employee wellness program look like? Number 12. In answering the question, what does a typical traditional employee wellness program look like? Let's begin with the primary wellness targets or behavioral targets. And that includes anything from the feel-good wellness model that we looked at last week in number 11, that is working for you or meeting a particular need. You can carry that forward from that feel-good model. And we also usually add an overall wellness score, which is what OWS stands for, which is part of a health risk assessment or a health risk appraisal. Usually we start into the heart health area and oftentimes include testing on cholesterol, blood pressure, and we tend to focus on the remaining relatively small percentage, somewhere around 14 to 17% of adults in the work setting in the US use tobacco products, either smokeless or smoking tobacco. We oftentimes begin to start dealing with obesity and overweight status, and we oftentimes also introduce the concept of medical self-care, and that's where we're providing physician-based advice to people about handling the common, usually self-limiting medical conditions that all of us encounter weekly and monthly. And we oftentimes increase our focus on the physical activity area as one of those primary wellness targets. The typical interventions that we match up with these include any intervention that we've carried over from the feel-good model that applies and is working for us. We end up including a health risk assessment and biometric screening activity. We often can include a flu shot or a COVID booster shot. We can do biometric screening and testing. We can also offer some corporate discounts and or subsidized membership for fitness clubs or fitness facility use. We can include a weight management program to help people with multi-session intervention around weight management. We can include a smoking cessation program or availability of a community-based program with some subsidization from the employer. We can include web-based health information and education. We can include some healthy changes in the food offerings in our cafeteria, vending machines, and or food trucks. We can include a self-care book or an app that can be used to help provide some of the medical self-care kind of support. We also can look more deeply at the design of our preventive medical benefit coverage and to include things that are sound from a clinical and technical perspective. We can personalize a wellness newsletter. We can include a short-term wellness challenge incentive program, perhaps around exercise or around the consumption of water or sleep activities, a variety of different areas of focus. We can also provide some smartphone apps that are useful for tracking things like food intake and exercise, stress management practices, other kinds of mental health and mental well-being aspects. And when we think about the participation levels for this kind of wellness program strategy or program model, we're generally looking at a higher level than we saw with the Feel Good. We are enticing more people because we're offering more and different activities. So that's 28 to 58%. It's pretty typical year upon year. Again, you may get higher numbers initially, but they generally will drop off unless you're doing some things with incentives or changing the content of the program significantly. The approximate cost per employee per year, if we don't include incentive costs or staffing costs, which can be done in a variety of low-cost ways, we're looking at somewhere between that $51, that's just above the Feel Good, up to around $200 per person per year. And that again is the pure wellness vendor budget side of things. In terms of likely return on investment, In the literature, there are about 15 or so studies that have been done on this particular model, the traditional model, and it usually comes out somewhere around 1.5 to 3 in terms of cost-benefit ratio, which converts to about 150 to 300% return on investment each year for a program like this. In summary, the typical traditional wellness program is primarily characterized by lots of activities and represents a typical wellness approach, which produces some health improvement, not a lot, but some health improvement and some economic return. But it is not generally considered to be the most effective form of wellness and worksite wellness activity. Now, for more information on this topic, put the following search strings into your web browser: traditional wellness programs, employee wellness programs, activity-oriented employee wellness. Next week, we will address the question, what does a typical results-driven employee wellness program look like? For more information, visit our website at www.chapmaninstitute.com.